Alright, this is Emily Peters, recording for Care of the Growing Family, Unit 5, Infant Feeding. So, the American Academy of Pediatrics recommends that parents exclusively breastfeed for at least the first 6 months of life. And definitely no cow's milk before the age of 1 year, and formula should have iron fortification in it. We don't introduce iron-rich solid foods until around 6 months of age unless the doctor recommends something different. But you can breastfeed for up to a year. So the calories required is slightly different depending on if the child is breastfeeding versus formula feeding. It's not a whole lot difference, as you can see from the notes above. Also, when we're looking at how much weight the child may lose during that first week, it's typically around less than 10% of the body weight, or they're about at 10%. We don't freak out if it's 11% or 12%, but I mean, we keep a close eye on it. Nutrients, the carbohydrates are adequate. Proteins are more easily digested in breast milk versus formula. Fats are fairly equal. Minerals. The big thing is iron must be supplemented by 6 months of age. Usually this baby should have enough iron stores from what they received in placenta and also what they're able to get from breast milk until about 6 months of age, and then at that point we need to start supplementing it, and that's about when we start introducing solids. Vitamin D supplements are needed for all babies to help prevent rickets. So essentially just kind of some things to think about. We have some different types of milk that is produced for lactation. So colostrum is that first early milk in lactation. It has like a lot of prolactin and things like that. And then as that kid starts sucking and the milk is getting made, then it starts getting more fortification and more, I'm trying to think, more fat and proteins in it. And the mature milk is going to be composed of 2 different kinds of milk. Colostrum is the very early stuff. You start seeing that it's very rich and like kind of a golden yellow color. It's really high in immunoglobulins, has high protein that helps facilitate the bilirubin binding, and it is a laxative, so that helps that baby have that first mixed stool. Then we start getting our transitional milk, and our mature milk then starts coming in around 5 days of life. Milk ends up having a foremilk and a hindmilk. Foremilk is that early milk in the feeding, about the first third of that baby having a really good latch. And then we go into the hindmilk, which is the remaining 2/3 of the milk, and then that has a lot of fat and protein compared to that early milk. So that's why we like these babies to suck for a decent amount of time. Like I said, there's lots of nutrients in breast milk: protein, carbohydrates, fats, minerals, vitamins, and enzymes. Just so you know that everything the baby needs is essentially in that breast milk. So what's some things going on with breast milk? We know it helps promote the growth of intestinal flora and getting that GI tract mature enough to start introducing other things to it. We also know that it has a lot of immunity factors, so that it helps protect that baby against pathogens, full of leukocytes, so those healthy white blood cells. And then the immunoglobulins are really high in that early colostrum, and as we know, immunoglobulins are really good for protecting that child. So breast milk affects mom's diet. The amount of fatty acid in mom's diet is going to affect how much is in the milk. Same with the protein, carbs, and minerals. If that baby doesn't eat much, or that mom doesn't eat much and doesn't get a well-balanced diet, that baby's breast milk isn't going to have as much of a well-balance. Okay, so that's something to kind of think about too. So if mom's dehydrated, the breast milk isn't going to be as fluid-filled, essentially. So just so you know that we have different formulas as well. Formula is better than cow's milk because it has a lot of extra additives to it. And it is broken down so that the babies can easily digest it, so it's even more similar to breast milk in a way. They are modified forms of cow's milk. Okay, if we know there's a lactose issue or another digestion issue, they do make other forms of formula, okay, that you see listed here. They have to make cow's milk less protein and less fat to make it more similar to breast milk. We also have the different types of soys and different things as well. Another thing to think about is some of our formulas already naturally have a higher calorie content to them for preemies, so that those babies get enough food for their growth. Bottle feeding. Big things to think about when you're bottle feeding these babies is to make sure that you are bottle feeding every 3 to 4 hours. You need to have a really good bottle that it doesn't really matter what kind, but one that doesn't allow a lot of air to get to the baby. When we're holding the baby, you want to have them in a somewhat upright position, no laying down. We don't want to prop the bottles as well, so that the baby doesn't get a lot of air. A lot of air is going to upset that baby's stomach. Preparation of formula, you want to really make sure we're teaching the families to follow the nutritional guidelines on the formula itself, on the ratio to powder to water, because if they don't mix it correctly, it could be too concentrated or not concentrated enough, and that can really throw off that kid's diet. If they're watering down or using more water than what the powder calls for, it's not going to have the nutrients that it needs, and that baby's going to become malnourished. If we have too much powder to the amount of water, then it's going to be higher caloried, and it can actually bind the child up and cause some other issues. We like to do a demand feeding for most babies, which means they kind of give us a heads up of when they're ready to eat. However, we kind of do a little bit of a modified schedule with that, saying every 3 to 4 hours. A scheduled means that we're really stringent, and honestly, sometimes those scheduled feedings aren't appropriate unless we know we need to get a specific amount of feeding in that child for growth. Behaviors during feeding. We want to make sure that it's a quiet area, that we're giving the baby lots of eye contact, we're holding them and we're loving them, because they're going to eat better versus propping the bottle or just putting the baby in like a chair and holding the bottle for them. It's really important for them to have that bonding. So that's stimulation. They really need to have face-to-face stimulation when we are feeding them. Really, the black and white objects for stimulation, when you're feeding them, it's not important, but just kind of thinking about at other times. Talking to them, touching them, because it's going to help nurture them and make them eat better. So why do we help the families choose a method? Our role is to listen to the family's wants, needs, and what's best for the baby. Breastfeeding. Advantages for breastfeeding. Maternal benefits. It decreases mom's risk for ovarian, uterine, and breast cancer. It promotes involution of the uterus, or the uterus going back to its normal shape. It helps the mom get back to her pre-pregnancy weight. It also helps with bonding, and it has a less cost. Essentially, it's free compared to formula. Benefits for the baby. It enhances the GI tract maturity by providing those antibodies and cell-mediated immune factors. Supposedly, it helps decrease allergies, ear infections, and death related to SIDS. It is supposed to help kids from developing insulin-dependent diabetes, atherosclerosis, and obesity. Reasons for not breastfeeding, time, no support. I'm trying to think. Mom's away, single mom, things like that. Moms that tend to breastfeed are moms that have had multiple pregnancies, have a college education, have a higher income. So with that, it goes with the education. Their baby is of a normal weight, and they're not enrolled in WIC, so there's no financial constraints usually. Formula feeding. Reasons to formula feed. Time management. Mom isn't able to be at home. It allows dad to bond with the baby during feedings. Easier, quicker. Maybe mom did it, so why should I do it? Big thing about it is making the decision. It really needs to be the parent's choice, and that mom needs to have a lot of support. Mom can't be resentful. Mom needs to be able to get her sleep and be able to have time to devote to breastfeeding, because it does take a lot of time out of her day. Combination feeding works for some. It doesn't work for all. If the parent wants to do a lot of breastfeeding, I definitely recommend that they work on the breastfeeding for a week or two before introducing other forms of, like, you can pump and bottle feed, things like that. That way the mom's breast milk is getting established, essentially, because it's a supply and demand type of thing. Really, if you're breastfeeding, you shouldn't need to supplement with formula unless for some reason you don't produce enough breast milk. Some other things that might affect that choice is cultural influences. What does your culture do? Some cultures are fully breastfeeding. Other cultures have said, no, you don't need to breastfeed. That support is huge. Employment, if they work full-time away from home, it's a little bit harder to breastfeed because that mom has to have time to pump and make sure that supply stays up while the baby's gone. A NICU baby sometimes may have extra challenges, so that could be an issue of why we may do one versus the other. So, breast changes during delivery. What's happening is your chest is getting bigger, and it's starting to get ready, essentially, to start producing milk. In fact, your breasts are starting to have that oxytocin being released and getting that milk produced. When the baby's born, we end up with a decrease in estrogen and progesterone that then increases the prolactin, which then when we have prolactin, that's released by that baby sucking and emptying the breast, and that's where we get that supply and demand. The more the milk is removed, the more prolactin that's being produced, so therefore more milk is being produced. If the milk isn't completely emptied from the breast, then you can end up with inflammation. Oxytocin is then released, is being released when we feel that ejection of milk or that letting down process. So we need that oxytocin to help with the milk to go. Continued milk production, we really need to have that supply and the demand. So if the baby isn't at the breast sucking, we need to have a pump going. Some things to help with the process of lactation is to have positive thoughts, smells, and sounds of the baby. If that baby isn't there to breastfeed, and those kind of things help release it. Baby-friendly hospitals are ones that are fully breastfeeding. There has been some stories recently of those baby-friendly hospitals where moms did not have enough milk produced, and then they end up losing them due to dehydration and stuff. So baby-friendly hospitals have lots of benefits, but we also need to make sure we're teaching those moms on how to recognize that the baby is getting enough milk. So the amount of wet diapers a day to is that baby sleeping well between feedings and acting like their tummy is full. How often is the baby waking up between feedings? Things like that. Big thing is the mom wants to breastfeed. We want to make sure that baby gets to the breast sooner rather than later to help with that initial process. So within that first hour, some great things with breastfeeding is it promotes that skin-to-skin contact, which is great for that baby to grow. We like to do an on-demand type of schedule. So that means these babies may be eating every 2 hours. Once again, we also think about that sometimes they may go 3 to 4 hours, as long as we know they're sleeping well between feedings. We have to be very careful with what medications mom is on, because some meds can cross through the breast milk. Support and education is just teaching mom how to take care of her breasts. So if they get sore, she can use lanolin, or not to use warm cabbage leaves because that'll help the milk dry up. Warm compresses versus cold compresses. Okay, I apologize for my phone ringing. I lost track of time and there was a meeting. So once again, warm compresses sometimes are better versus a cold compress. If mom's nipples are sore, the lanolin is really great for that. If they're dry and cracked, lanolin helps with that as well. However, she could take some of her breast milk and even rub that over the surface, because breast milk has a lot of healing properties as well. Sometimes just standing under the steamy shower will help with some of the breast pressure and uncomfortableness of her breasts that are going on. Now, if she starts to get a fever and along with the tightness and soreness, that could be a sign of mastitis, and she may need to get antibiotics. One big thing is to make sure mom keeps feeding that baby, because that will help with some of the pressure. I'm trying to think what other tips I have. I think that's about it. Benefits of human breast milk. I've kind of stated some of these over and over again. One big thing is it's a newborn human, so that's the best milk for them. Just like cow's milk is best for baby cows, and giraffe milk is best for baby giraffes and things like that. It is made for their system, and therefore it is easier to digest. Because it is produced, and that's how our bodies work. We also know that breast milk has tons and tons of great properties that we can't make in formula, such as the immunity type of thing, or even some of the transfer of the iron and things like that naturally. I mean, we can put iron in formula. As long as we have a good supply and demand, the breast milk is always available if the baby's ready to eat. However, with formula, you need to make sure you're always carrying formula with you, have clean water, and have bottles available. And so sometimes it's just easier to put the baby to breast versus mixing something. Infection control, it's good for mom, it's good for baby. So many healing properties in breast milk. I've kind of mentioned a bunch of these. Cheap, always available, good bonding. Correct latch is huge. I have several slides for you guys over latching. We need to make sure we're getting that kid latched correctly, and making sure that the baby is comfortable as well. When we're wanting to latch the baby, we tickle the lip kind of right off to the side with the nipple. And then the baby will root and open up their mouth towards it. And then that baby should have a nice big open mouth, and we can get that breast into the baby's mouth. They may get all of the areola, but we want most of it in the mouth, the whole nipple and most of the areola. Some ways to also help the child latch on is sometimes having mom expectorate manually a little of the breast milk so the nipple is wet. Not having that very rigid feeding schedule is best, so that on demand. Mom needs to be calm, comfortable, and needs to be a quiet, soothing environment because the baby's going to react off of stress. Support of the mom is important to make sure she's doing it correctly and to make sure she's comfortable and that she is not struggling as well. So right here we kind of see some decent latch, but we're also seeing some of the things that are going on in the mom's body as that baby is breastfeeding. Here's some issues that we can have with our breasts that can make feeding hard. We have an inverted nipple, which is normal. That flat nipple can be harder for the baby to latch onto. The inverted nipple, the baby really struggles, and same with one that retracts. So we do have things available like nipple shields and cones and things that you can put in the breast, or like a breast shield, to help prevent the nipples from being either flat or inverted or retracted, so the baby can get that good latch. We need to have that nipple inverted or erected because that's what stimulates the sucking reflex because it'll rub the roof of the baby's mouth. So in our assessment, we need to know what mom knows, do a good assessment of mom's breasts, and then that's going to help us figure out what we need to help make that breastfeeding successful. We also look at that baby. If it is deep asleep, is that a good time to breastfeed? No. If that baby is rooting around and showing cues, then that's a good time to breastfeed. Okay. When we're helping that mom breastfeed, we're going to help her figure out how to hold the baby. This is really a hands-on type technique, and I always give the parents a heads up about that and be like, hey, I'm going to probably end up touching you, just so you know. I hope you're okay with that, and get that permission, because sometimes I literally have to get my hands on there to show the mom what she needs to do. I may even grab the baby from her, or I may even use my hands on her breast and show her how to hold it and move things around. Latching on, making sure that baby, I've found that if you kind of line the baby's nose up with the mom's nipple, and then when you get to the stimulation of the cheek, the mouth will open and the head turns back, and then the nipple should be right about where the upper part of the mouth is. We also want to look how they're sucking. They want to have that big open fish mouth, and we want to be hearing consistent sucks, and you should hear some swallowing. Removal from the breast, we want to put our finger and break the seal of the baby's mouth around the nipple instead of just pulling it out, because it's going to cause a lot of trauma and irritation to the mom. The feeding should be every 2 to 4 hours, and a good 10 minutes at least. Some babies will breastfeed for 30 to 35 minutes, sometimes 40 minutes. Here's tandem breastfeeding. And they're in like a football hold. So here's kind of giving you an idea of what we want to do. The tongue is under the areola. You can see how almost all of the areola is in the baby's mouth. You can see how the nipple is kind of up and touching the baby's roof of the mouth and stimulating that sucking reflex. It's not as easy to see, but you can kind of see how that baby's body is aligned. It is not twisted, its head's not twisted. Mom is using a C method of holding her breast, and it's up quite a ways, and that's also helping support the nipple and helping her move the breast to the right angle. You can also see how she's relaxed, and the baby is very relaxed. Here's a football hold, the same kind of concept, except for the baby's leaning against a pillow. Mom is able to support the head with her hand, and she's once again supporting her breast and adjusting everything with her other hand using a C method. Here is a cross cradle. Cradle. And this is side lying as well. There you go. Can you see that big fish method on the mouth? That the mouth is big and open like a fish. That is what we want to see, because that should be a good latch right there. And you can see once again almost all of the areola is in the baby's mouth, and you can't see the nipple, so the full nipple is in. Here is just once again kind of showing you that movement that we need to have. Okay. Problems with breastfeeding: babies get awfully sleepy, and therefore they're not going to be alert enough to feed, like with high bilirubin levels. There's some talk about nipple confusion. Really, I don't believe there is such a thing. There used to be this moniker that if you give a baby a bottle, they will never breastfeed. The big issue is when the bottle lets the milk out, it's different than when the breast lets the milk out. When the baby is sucking and closing their mouth on the breast, the mouth, as they're closing, is pulling the milk out of the nipple and into their mouth. Whereas when we close our mouth around a bottle, when we close our mouth and close off the nipple of the bottle, we're compressing the milk, and therefore the milk doesn't come out. So it's almost the opposite when they're getting the milk. But babies tend to, if they've had the breastfeeding established, they should be able to go from one to the other pretty easily. The big thing is getting the milk from the bottle is easier. Suckling problems can sometimes, like lip tongue-tied to, the nipple not being able to erect and getting a good latch. So we need to work with some of those things. Jaundice makes them sleepy. Prematurity is they're sleepy. They don't have a lot of energy, and they may not have a suck-swallow reflex. And then there's neurological issues as well. We've mentioned a bunch of these, some breast problems, the different nipples. If you've had your breast augmented from a surgery, that actually could affect the milk production. If mom's sick, milk supply can go down. Certain meds can affect the milk supply as well, besides crossing through the breast milk. Working, they may not always have the time to keep up that supply and demand. So milk expression, you can do it by pumping. You can also massage your breast and cause the milk to come out. When you store breast milk that you've pumped, you can store it in a fridge for 5 to 7 days. In a general fridge freezer that most of us have in our kitchen, you can store it for 3 months in the freezer, but once it's thawed, it's only good for 24 hours. In those big deep freezers, the breast milk is frozen and good for a good 6 months. When you have multiple births, there's lots of trouble with making sure mom has enough supply, but also getting them both breastfed and making sure she has time to sleep. Weaning is unique because because of that supply and demand type of concept, that her breast may still want to produce more milk than what is needed. So she needs to slowly decrease like the amounts of breastfeeding over time instead of just an abrupt stopping. You can also do those warm cabbage leaves in the, or even regular cabbage leaves without warming them up in the brawl, and that'll help dry up the milk. The answer to this question is D.